Hello, this week's journal is on cognitive behavioral therapy, specifically talking about different sessions that have included CBT. In all of our sessions, we use CBT, and the main aspect of CBT that I think is used by the therapist that I'm precepting under is journaling, although there are a lot of parts of CBT that are included. I've particularly enjoyed just from classes in MN 661 learning about unraveling cognitive distortions, which we do that in CBT, and we just challenge some of those thoughts that are there. And it was interesting for me just to see how many of those cognitive distortions that I use even just in my everyday life that I can apply cognitive behavioral therapy to. Some of the ways that CBT is used in the session, like I mentioned, are through journaling, and then also through cognitive restructuring, where we take those thoughts and we challenge them and then we restructure them to kind of rewire a patient's brain into positive thinking. And then we also play the script until the end, which is where we take that negative thought and we go all the way to the end and say, okay, so what's the worst thing that can happen? And usually, even the most negative thing that can happen is going to have a positive result. And we review situations where there have been a lot of negative anticipation about something that has come up, and then the thought is challenged and we realize that good came out of bad. And then we also use and have used, and I've learned this even in some like gifted and talented classes that I was in as a child, just progressive muscle relaxation, just starting at your head and going to your toes, which is always a really good practice of just learning to relax. As far as DBT goes, we do have a few patients that are involved in dialectical behavioral therapy. Specifically, that is really good for patients who have excessive thoughts of suicidal ideation or maybe have personality disorders. Those trainings that we sometimes refer patients to here are in a group setting, and a lot of that is just giving those patients tools to challenge those thoughts and then again react in relational environments with ways and responses that are appropriate, learning to hold back responses and just what might be a more appropriate response in various given situations. As a whole, I think there are certain diagnoses that require DBT in it. Things such as personality disorder cannot be corrected or healed per se with medication. It has to be through DBT, which is part of CBT. So that is a very good method of helping a patient learn. So overall, all of the sessions that we use are CBT and implementing some form of CBT, and it's been very good for me even in my own personal life to just practice putting away some of those cognitive distortions that I've learned about through this class. Thanks so much. Bye-bye.